Good afternoon, colleagues. Last 1 month we are not been very busy in our clinical practice. I thought that I will share my experience about young myocardial infarctions. We have seen couple of patients who has presented at a young age. By definition, we call young myocardial infarction when it happens at less than 40 years, 40 to 45 years. And when it is less than 40, then we tell is that very young. So what is the speciality about myocardial infarction in this subset of population? Their muscle is not conditioned for a heart attack, so they suffer more muscle damage, and overnight the ejection fraction can come down, and the rest of the life they have to go with a weak heart. As a clinician, you must be getting phone calls or WhatsApp that I am feeling uneasy sensation. So please don't get into the trap of giving antacid or paracetamol over the phone. Insist them to see clinically or at least to do a ECG. And this is particularly shown in patients who have risk factors. So what are the risk factors below 40 years or below 45 years? Number one is family history of premature coronary artery disease. You can ask over phone. A history of hypertension, diabetes, dyslipidemia, smoking, any one of them. So if two risk factors are there, then you can need to exclude that the patient is not having a major myocardial infarction. Nowadays we are also discussing about non-conventional risk factor like sedentary habit, consumption of dairy product. So probably these two are very important in today's scenario when you see the sweets shop are open and people are not doing much of physical activity. Remember any patient who present with upper abdominal or chest discomfort or perspiration which seems to be very much like a myocardial infarction, even at young age, don't keep them at home. Do a ECG and keep a close follow-up so that you don't miss them. And suppose you have diagnosed a myocardial infarction, so again there is a controversy that whether you should give a thrombolysis or angioplasty. But anyway, even in pre-COVID or post-COVID area, majority of the people will come late. So if they can be diagnosed within 12 hours, try to thrombolyze immediately. And rest of the people who have an osteogenesis elevation, MI, like who has a troponin elevation only, you can manage with low molecular heparin, dual antiplatelet as a loading dose. And if they don't want to get admitted, please keep them under a close follow-up. So probably the number of patient which has calmed down is a temporary one. You don't know how many people have suffered myocardial infarction in last few months. Thank you.